Pediatric rehabilitation, by sort of its nature, you have to think about it across the continuum. And as I think about a continuum, it could be the continuum of ages and stages. So we are involved with the early diagnosis in infancy and in toddlerhood of new conditions for children which will impact their function. But those children will grow and develop into adolescents and then into adults. And so we have to start thinking about providing care across that continuum. As I think about a rehab physician's role in helping to transition kids from the hospital into the home setting, I think we're in a great position to really lead that charge. We understand functional impairment. We understand the needs of a family in terms of how what the home setup might need to be, what equipment they may need, what services to help support them. And I think that we have that ability to really lead that effort. And in fact, we do. Whether the child's on our inpatient rehab unit and we're working on transitioning that child with a high-level spinal cord injury that has incredible medical needs, we are helping that family to make that transition. We're also doing it if a child isn't going to come to rehab, but still is going to be transitioning home with multiple needs. So our consult rehab physicians, our therapy teams are working together to help the primary teams and the families to make that transition home. So I think we are probably in the best position. We see that those children and the families, when they leave the hospital and then come back, we hear what they say in terms of the equipment that they have or they don't have that might make their life easier, or the person support that they have or they don't have that will help them to be more successful. And so I don't believe there's any better physician provider that can help with this challenge. The BOLD initiative is exciting for me for a number of different reasons. One, I think that the Academy has identified some core areas to focus on, and really important ones. Obviously, as a pediatric rehab physician, I'm excited that pediatric rehabilitation is a focus for the BOLD initiatives. But I think that for across the board, the focus on outcome is so core to who we are. As we think about value-based medicine and healthcare and the direction we need to go, and really are going, outcomes are so critical. And I think that having the voice of the Academy and the members behind that is so critical. I think that we are small, and I describe us as a quirky field. People don't focus on function, or at least historically they didn't. But they are now, and I think that it is imperative for us as a large organization with that critical mass, the voice of all of us, to speak to that and really lead, again, that charge with providing value to our patients and their families.